Hi, doctor. I just saw Miss Wells. She's a 28-year-old female who presented to the clinic with complaints of shortness of breath and wheezing following a near asthma attack she had 2 days ago, and the symptoms haven't resolved. Do you have time to go over the information a little further and talk about the diagnosis and plan that I came up with?
Yes.
So at the time of the asthma attack, she used her albuterol inhaler. Symptoms decreased, but they didn't completely resolve. She reports she was at her cousin's house and exposed to cats when this all happened. She is complaining that her current symptoms are interfering with daily activities and concerned that her PRN albuterol inhaler seems to be less effective than previously. On assessment, chest expansion is symmetrical with respirations, normal fremitus, symmetric bilaterally, chest is resonant to percussion, no dullness, bilateral expiratory wheezes in posterior lower lobes, bilateral muffled words with notable expiratory wheezes in posterior lower lobes, no crackles, and in-office spirometry reading is FVC 3.91 liters, FEV1 FVC ratio is 80.56%, and SpO2 is 97%. So I diagnosed with acute asthma exacerbation, and my plan is based on the NAPP guidelines, which would start with checking environmental factors and adherence, which we did during the assessment. We know that the cat is what triggered it, and she does adhere to her as needed albuterol. Step one would then be to prescribe the PRN albuterol, but she already has that. So next step would be to prescribe a daily low-dose inhaled corticosteroid, such as fluticasone. Ms. Wells would be advised to follow up in 2 to 6 weeks for a reassessment. If asthma is well controlled for 3 consecutive months, her regimen can return back to just the PRN albuterol. And the components of a well-controlled asthma include less than 2 days per week of symptoms, less than 2 times a month of nighttime awakening, no interference with normal activity, and SABA use is less than 2 days per week.